My name is Pamela Rosano, manager in the Continuing Care program here at Mackenzie Health. Within the Continuing Care program, we have 15 beds that are dedicated to palliative care. Palliative care is a combination of active and compassionate therapies intended to support the needs of individuals and their families that are faced with life-threatening illnesses. Our palliative care team here at Mackenzie Health is an interprofessional team. It includes physicians, nursing, social work, rec therapy, volunteers, chaplaincy, just to name a few, including a complementary therapy that does Reiki and aromatherapy at the bedside. One of our most recent accomplishments here at Mackenzie Health Palliative Care is the recruitment of music at the bedside. We're so happy to be thrilled to announce Dr. Kevin Komisaruk that comes here from the University of Toronto Faculty of Music. It is a collaboration between us and the University of Toronto. He comes once a week. Here, when we look at palliative care, we really want to look outside the box, and we consider our patients as living, even though they have come in to die. When Kevin comes and he does a referral, he goes to the bedside, he listens to the story of the patient and the family, about what they liked, about what they enjoyed. When we think of music, and we hear a song in the car that we reminisce about from maybe 20 years ago, we remember the good time that happened at that time. Puts a smile on our face. Kevin listens to those stories and he plays his clavichord for the patient and the family. He never plays the same music twice. Sometimes it's faster, sometimes it's slower, sometimes it's louder, sometimes it's quieter. He takes the cues from the patients themselves. It soothes them, it brings back memories, and it comforts them. When we look at the patient experience, I can give you an example of when a patient came to us to palliative care as end of life. She was very distraught and she was upset. She was disengaged. She laid in her bed with her arms crossed. She wouldn't talk to the family, she wouldn't talk to the team. We tried to get social work, complementary therapists, physicians, chaplaincy. She just didn't want to engage in conversation. Through conversation, we found out from her husband that music was a big part of her life. We asked Kevin to come and do a session at our bedside. So Kevin came and he played for her for 20 minutes. He played a beautiful song, one that she knew. She lay there with her arms crossed. But at the end of the 20 minutes, the lady put a big smile on her face and she clapped her hands for him. It was a moment of joy for both her husband and her. She passed away a few days later, but the husband went and left Mackenzie Health knowing that she did have a good moment at that time.